Welcome to the Sprig podcast, your source for the most relevant topics in pediatric dentistry. I'm your host, Dr. Jarod Johnson. Recently, Joe Biden announced a mandate for employers over 100 employees and those that take Medicaid or Medicare dollars mandate the COVID-19 vaccine for their employees. This can be challenging for dental offices, and here to discuss the topic with me is Paul Edwards, CEO and founder of CEDR Solutions. CEDR provides HR solutions for small and medium-sized businesses. They also create employee handbooks and do an excellent job with HR consulting if you have an issue. And I have used them since I opened my office, and I am very, very happy with the services they offer. And it's just something you don't learn in dental school. So welcome again back on the show, Paul.
Yep, I'm very happy to be here. Thanks for inviting me.
So this has been kind of a really hot topic, and there's no right or wrong. My personal opinion is I don't agree with the mandate because I think for your healthcare, you should be able to make your own choice. I have hypertension, and I make choices. My doctor said, well, you can exercise, you can stop drinking alcohol, and you can cut out salt. Which one of those would you like to do? And I said, yeah, I would love to cut out salt, but I'm not going to start exercising. I'm still going to have a beer every now and then.
Mm-hmm.
And he said, well, okay, that's fine. We're going to go ahead and have you back reevaluate. I lowered my blood pressure. And then all of a sudden he said, well, it's not enough. We need to put you on a medication. And that's okay. But I made that choice personally. And I think everyone should be, especially in our country, available to make those decisions. And right or wrong, whether you stand on one side of this or the other, I know there's people out there that say, well, you're not vaccinated, you infected my ex, and that's unfortunate. I understand that, but also we all are here free to make our choices. But it's really important when we look at this new law that might be coming in to see what's potentially going to have an impact on healthcare and our businesses. So can employers mandate a COVID vaccine for their employees?
The answer to that is yes. You currently can do that. There are two states. So whenever we talk about laws that affect HR, we generally have to start sidestepping and talking about how different states and different localities, cities, counties might also have rules in place that you'd have to know about and follow. So in broadest sense across the country, you can mandate that your employees have vaccines so long as you recognize that there are exemptions for that an employee can seek, and you understand how they would be able to seek those exemptions. Those two exemptions are medical, under the American with Disabilities Act, which applies to practices with 15 or more employees. By the way, if you have less than 15 employees don't do the happy dance yet, because most states and localities have applied some law akin to the ADA to you as well. So they've lowered the threshold below 15. And then the other exemption, which is a little squishier and a little more difficult, but is the religious exemption. And this is not new. This is not new news. This has been in place for many, many years. So yes, you can mandate vaccines, and you need to respect those two exemptions.
I know McDonald's, Tyson Foods, Delta Airlines, Microsoft recently announced they're going to mandate vaccines. Disney have all followed suit. And it is definitely something that should be top of mind at our dental office. I think it's unfortunate because I think it could cause a big problem in our healthcare system. If you look at taking Medicaid or Medicare dollars for the vaccine, and what's the lowest paying insurance? What's the lowest fruit on the tree to cut off? If you have employees that might be against it and you don't want to lose them, I know it's hard to hire right now. That might be something you drop, and it's going to hurt those who need these services the most.
Yeah.
And that's what I think is the most unfortunate oversight in this plan. I think that's probably, for me, the hardest thing to swallow as a provider, is that it may not be possible for you to still have employees and continue on caring for these people when there's this mandate out there. What are you seeing in states, I guess, that have vaccine mandates? What are you hearing from your clients?
Well, we have several states right now or jurisdictions which have some sort of mandates in place. In the last question, we talked about can you mandate vaccinations? And I said there were a couple of exceptions, and just because we're in the podcast. Montana and Oregon have some rules in place that say that you can't discriminate based on vaccinations. And that kind of throws a little bit of a monkey wrench into the requirement for it. The states that currently have mandates, as we are speaking today, California has some specific, the state of California, Berkeley, LA County, and San Francisco have their own versions of the state mandate in place that are quite a bit more strict. Denver in Colorado has mandates, although outside of Denver, the state does not. DC, Maine, New York. New York has a temporary restraining or temporary injunction on it right now because they have tried to, in some shape or form, exclude the religious exemption from their mandate. Oregon, Rhode Island, and Washington all have some sort of mandates in place. I do want to speak to that another side of the coin here. I do understand where you're coming from, this choice, and I'm the same way. I don't like things forced on me. I remember I was against the seatbelt laws. I'm old enough that there were not laws at one point, and I'm old enough to have been in a car that has been in an accident and been slung out of the back seat at 12 years old, basically onto the dashboard in the front of the car because I didn't have my darn seatbelt on. Until I saw a video of a car accident from inside, and the one person who was not belted was spinning inside of the car and took out the other three people. I mean, literally killed all three people in themselves because they weren't strapped in. And I do want to share one other thing, because we're talking about how these things affect. I mean, I've had a couple of practices have to shut all the way down for 14 days in the last month because 4 employees out of 9 didn't want to be vaccinated. And one of those 4 employees was pretty cavalier and went out and brought it back. And I won't go into the details, but they literally shut the practice down. And so the cost was astronomical. I mean, you get it. If you have to shut down for 14 days and turn your patients away for this reason, for this stated reason, it's not good for your public image, for those things. So, again, look, from my point of view in advocating for employers, I'm kind of happy to see the mandates come down because it's taking the heat off my employers who, for various reasons, either want to have it in place or not. That's kind of the position that I'm taking on it.
Absolutely. I totally understand that. It's great to have the discussion, and what I see is a different side of the coin. And it's great to have this discussion because, I would love it. I took the vaccine. I would love it if my staff would get it. But I really don't want to have to make that personal choice for them. Yeah. And they have different reasons for it. And I understand we want to protect number one, our patients, and number two, our staff. And that's a discussion. We've encouraged it. We've had some that take it, and we have had some that have not, and we've had both exposed, both have had it, and it's a really difficult thing to discuss with a lot of people because of social media these days.
It's so difficult, and there's so much misinformation, and there's shaming, and there's it's not easy right now. I mean, it is the thing that we're getting the most calls about, and it has changed so much over the last 2 or 3 days. We're recording around mid-September. Things were pretty okay through the 10th, and then all of a sudden, it really changed out there for people calling in for help.
Yeah, absolutely. I think it's got to be on every practice's mind. What do we do? How do we answer these questions that are coming? We don't even know what the Department of Labor is going to come through with yet. They just have the order, and it's kind of up in the air and in a little bit of a haze. But I would love it if, I would love to encourage it. I took it, like I said, I have no problem with it, but we got to kind of decide what's going to be the best thing for our practice to stand up to these laws, because ultimately you could have two factions in your practice, one group that's vaccinated, one that's not, and the
We already
mandate's
have it.
out and
No,
the
no,
mandate's out.
Yeah, we already have it in a very real way. It's one of the, it's never easy keeping your family together, and we've got our work families, and there are some really strong held beliefs here on both sides, and so it's just not easy. And as you pointed out, up to a few days ago, and this hasn't changed, nobody wants to fire someone. It's hard to find good help, and nobody wants to let someone go. And that's not what people have to do. Now, there are a few mandates where if a healthcare worker and that healthcare worker covers dentistry, doesn't take the vaccine, they're supposed to be terminated, but that is not the norm. There is always an accommodation for it, which is, okay, if you're not going to get the vaccine, then you've got to test. And you've got to go out once a week. You've got to get a test and show that you're not infected, and be hyper vigilant with the PPE. I know people are loosening up. I know that there for 6 months we could even make people almost eat through their mask at break. I'm being a little facetious, but I mean everybody got it. Don't take your mask off. I don't care where you are in here, and those sort of precautions are starting to kind of drop away, and it just makes it difficult. So, yeah.
Yeah, I completely understand. I was at the point where we were in our community, we were at a very low point with exposure. And I started going out without my mask, and now I put it back on because it's just so frequent. And to me, I'm worried about, it's probably going to come to my family from my kids going to school that are unvaccinated, don't have the opportunity to do so. And we're going to probably at some point have to close for 14 days. We had someone that was a high risk exposure at my office, and we followed the CDC guidelines. They tested negative. We didn't allow them to work. And then 2 days later, they tested positive. So
we've seen that as well. We had one doctor who he knew he got it from the team, and he kept testing negative, and they kept saying, good news, you don't have it. And he's like, there is no way I have it. It was day 8 when it finally broke through and showed up in his 4th swab. Yeah. So it's not perfect.
So the other questions people have with this is there's obviously going to be a lot of litigation down the road with this. How do you think that this mandate is going to last in court if someone challenges it?
Well, are you talking about the Medicaid? You are talking about the Medicaid mandate.
Yeah, mainly that's my concern, because I think most dental offices, if you're not a DSO, you're under 100 employees, you maybe have 8, 9, maybe 15. And the problem is, that's my biggest concern is for these kids is how, providers are just going to stop. They're the lowest paying. It's common sense. So
no, I get it. So, okay. So on the Medicare, when we talk about this mandate coming down from Biden as they write the rules, they're going to continue to allow the exemptions. So the exemption for medical reasons or for, legitimate religious reasons are still going to be in place. So I think that the law is going to hold up underneath those standards. What I'm not sure about is the number 100. I don't understand whether you have 90 employees or 110 employees. I think that the 100 is pretty arbitrary. I believe that the president, giving him the benefit of the doubt or some, you got to guess at what the advisors are thinking. I think that they were trying to remove really smaller providers and still influence hospitals and larger organizations to try to get the vaccines in there. But I don't know. As far as the Medicare mandate, they haven't written this yet, Dr. Johnson. And since they haven't written, we really have not seen a single word. Not a rough draft or anything. It's really unclear to me. It would be hard for us to make an argument that it's going to get struck down. I just haven't seen a good one yet, but there's still time. They're working feverishly on it in the background.
Well, I'm sure we will probably eventually see it, probably before the Supreme Court, before this is all over, given
Possibly.
the division in our country right now, whether you stand on one side or the other.
Yep.
I was looking up today. It looks like it's a for every fine that they're planning, they're looking at it's going to be $14,000 per incident. Is that what you've heard too? What are the
Yep.
consequences if you don't follow this mandate?
14 grand per incident. And, in the HR world, generally, when we look at something like that, it is a piling on. If you look at a HIPAA breach, they can actually look at each individual breach as part of the fine. And it just piles up on you, and then they make some kind of settlement with you. But regardless, it ends up being tens of thousands, if not hundreds of thousands of dollars, depending on what's going on. So I don't think that fighting it as an employer is going to be your thing. I think you're going to, as an employer, you're going to have to figure out how to comply with it one way or the other, if you're going to be doing business with them.
Yeah, if you look at Southwest Airlines today, they just took the route that most of the airlines did. They're offering some pay for their employees to encourage them to get the vaccine. And, I think that is a more proactive way of going about this than waiting for a mandate. If you encourage them to get it by financially, it may be easier on you in the long run. You may spend a little bit of money giving them a bonus for getting it, but then you won't have to deal with the repercussions of what the government is doing if they all end up getting it. What have you found that works for encouraging employees to get the vaccine? I know a lot of other people that I've talked to are encouraging the vaccine almost daily to their office. What's worked the best in the HR world to discuss this and move forward? So maybe if you get everyone vaccinated, you don't have a problem down the road.
Well, okay. First, let's talk about incentives. The EEOC, the Equal Employment Opportunity Commission, came out and gave us a ruling about a month ago, maybe a little bit longer than that says under the ADA, it's okay to offer incentives as long as the incentives are not so strong as to be coercive. Now, if that sounded like gobbledygook to you, that's because it is. Because what is coercive? I mean, I guess coercive to someone who makes $100,000 a year would be $10,000. But I guess if you make $40,000 a year and I offer you $5,000 to get the vaccine, then that would be coercive. If you're making $250,000 a year, $5,000 might not move you. That set aside, that kind of vagueness set aside, one of the problems that we see coming up is we've had some doctors try this, and the employees who just went out and got their vaccine because they felt like that's what they should do, whether it was for whatever reason, got pretty upset and people who held out, who then went and got their vaccine, got something special. And so the doctor had to turn around and give everybody the $175 bonus. Now, she wasn't upset about doing that. She was like, you know what? I was happy to write that little check to everybody. It was a nice thing for me to do for the team. But she was infuriated that she had one group of people who just went out and did what she said, did the right thing by her standards. But she had another group who she had to actually pay to go do it, and that was kind of frustrating. So we have been sticking by this guidance. You asked me, what are some of the best things to do? Encourage, lead by example, cajole, do whatever it is you can. If this is what you believe you should be doing to encourage people to be vaccinated, or while at the same time respecting the exclusions that they can reach, without pushing too hard on that. So, I mean, these are really your only tools: education and encouraging, up to a point where you may decide that you have to mandate. If you do mandate, you have these exclusions, and they're quite broad. And if people can legitimately get access to the exclusions and you grant them, then you do have a testing backup to make sure, to the best of your ability, that you would catch an infection somewhere midstream and be able to keep it out of the office. Regardless, you're still maintaining PPE standards high. We had that early study where the two hairstylists were infected and saw a couple hundred customers, and they were just wearing, everyday paper masks, and they didn't infect anybody. So this is where we're at right now, unless you're being required to, as an employer by your state or your county or your city, to force vaccinations. And then if you are, to come full circle, you've got to understand these two exemptions. You got to get with somebody in HR somewhere and get the right forms, use the right methodology, because even in the exemptions, you want to be careful. You don't want to learn about some medical condition that you don't need to know about. I mean, it's this person has a medical exemption. You don't want to know anything else. You want to try and stay out of that conversation if you can.
Yeah, I think the ADA just came out with a guide I believe it was today or yesterday, on guidance for documenting vaccination status for COVID. And that was one of their things, the minimal amount of information necessary to be in the exemption and in the record. And I think most states have a exemption form. I know Iowa does that. It comes from the state. They can fill that out, get it notarized, and bring it to you. It's probably best to keep this in a paper record rather than digitally with all the security at this point.
Yeah, even the paper or even digitally secure. I mean, if they're in our HR vault or something like that, they're going to be secure. We did this. We've always provided the forms, but we did this a year and a half ago. We've been providing these exemption forms, and that's been going on for forever now. These things are coming.
Yeah, we've had the hepatitis B is the main one that dental providers have to have, and it's more of an opt-in or opt-out. That's not mandated, so it's a little bit different. One other thing I saw that one of the major companies is doing, I think it was Southwest, if I recall off the top of my head, is they're ending quarantine pay for people who are not vaccinated. Is that legal? Is that what's going on with the CARES Act and where we are right now with pay? I know September here, it's expiring here this month. And where are we with moving forward with the Families First Recovery Act?
We do not have information that it's going to be extended, but we would not be surprised to see them through budget reconciliation extend some form of the CARES Act. For anybody who's listening, one of the features of the CARES Act was that if you had an employee who had a bona fide related COVID, we'll just call it bona fide COVID instance, either they're sick or you think they are exposed and need to stay out for testing for a few days to see if they're infected, you could seek a tax credit through the IRS through your payroll. You could pay them 3/4 of their pay, and you would be reimbursed 100% of that. It was pretty handy, pretty good thing. Saying that, if you are availing yourself of the CARES Act, in the statute, it is not legal to withhold it from someone who is unvaccinated for whatever reason. And if you did that to punish people, and we got a lot of calls on it, like, hey, if they're not going to get vaccinated, then I ain't doing it. Our answer to that is, well, you did it for others, whether they were vaccinated or not, and you can't draw a line in the sand and use this as a parenting tool. You have to pay everybody, or they could go back and pull all of the reimbursements, which could be a substantial amount of money for some people. And you would have to pay that money back to the IRS. So when we look at Southwest, or whether it was Southwest or it was any other company who at one point was paying COVID pay, but they were not availing of the Family First Act, then they're not subject to those rules because they weren't taking any money from the government. They probably weren't eligible for that money. I think they're too big of an employer. However, I think you got to be careful at this point about holding back some benefit as a punishment for not doing something. I'm just saying that you just have to be careful that you apply it the right way. I'm sure there are exceptions for people who are under the exemptions who then end up getting COVID and they would then still reimburse them. I'm sure there's some mechanisms in there. I do want your listeners to be very careful about mimicking large employers. I just want to be super careful about thinking, well, they're doing it, that means I can do it, because that is just not true. And on the other side of this, trust me, if they have to pay a lawyer $500,000 to fight this, to win it, or even lose it, that's no skin off their neck. it would cost you the same $500,000. It would be skin off your nose if you had to do that. So I like to put that out there. None of us have that kind of money.
Yeah, absolutely. I think that's great advice. And I think if you want, though, at this point, you can end it for everyone, but you got to do that across the board. Is that correct?
You could stop doing it. No. At this point, if you have done it, if you have been reimbursing, then you need to maintain that through to the end of this, which is at this point September 30th.
Yep.
And then like last time, they renewed it, recharged it. Maybe on the renewal and recharge, you could opt out and say, I'm not going to do it anymore. That was a really good question. I don't know the absolute answer to that.
Yeah, I think I think that's something we need to consider, because that may also encourage people to get the vaccine, right or wrong, whether you go down that road or not. But that would be something you'd want to consult with your HR provider and your legal team to make sure that things like that are done right.
Yep.
My last question is, you mentioned a lot about the alternative today. I think it came up 2 or 3 times about the alternative of testing every week. And I think a test, my wife just had one a while ago and it was $85. Is that something that's, if we move forward with the employee mandate, is that something that is absolutely required by employers, dental employers, that the employees go get that test every week?
Okay, so there's some gray area here. All right, so let's first talk about the vast majority of America where there is no governmental mandate in place. That is established law. If you require somebody to do something which is directly related to work, as the employer, you have to pay for that. So that means that if you require people to go get tested, you would have to pay for their time to go and get tested. The time while they're being tested, you have to pay for the test itself. All right, that's the law. Now, we think that once the government mandates it, that the rule reads, when an employer requires, that's how the law starts. Anytime an employer requires. So when the mandates come in place, you can no longer say the employer is requiring it. The employer is complying with a law. So they're not requiring anybody to go get testing. They're saying, I have to show that you are tested, and the state is saying that you have to be tested, or the city, or whatever it is. So we make I think the very legitimate argument at that point, then the testing falls over onto the employee. Now, it's a great point I'm making, but not everybody agrees with me. Not everybody agrees even with the consensus that we have built here with our legal team. There are entire bodies of attorneys in California who think that they're still going to write rules that make the employer pay for part of this and not put it on the employees themselves to go out and get the testing. And I mean, I could speak to this, from a lot of different angles. But it's a good question you asked, because I say, well, you couldn't give them the other option. And now how do you feel? You've got 35 employees. You've got 8 of them who aren't claiming any exemption. They just don't want to do it. And now they're going to cost you $85 a test, week in and week out. All of that time could be overtime. Now, how do you feel about people taking the vaccine as an employer? And by the way, you got to keep up with all of that. You got to keep up with who tested. The testing starts to drag. I mean, it is a rock and a hard place for an employer. It is tough, and there's no other way to put it.
Yeah, I think this has been probably the biggest thing top of mind for me is what's going to happen. What is the law going to look like? How's it going to affect a small dental practice that sees 60% Medicaid? I mean, that's my livelihood. And how do you get through that and address these challenges with your staff? And it's unfolding before us, but it's just so complicated right now. I don't know what's going to happen, but hopefully we get some answers. And I think the biggest thing that we touched on today is to encourage your team to take the vaccine so you don't have to take a hit when this comes through. So your advice, I mean, we even disagreed on things today, and that's definitely okay.
It's fine.
It's fine. And it's fine to have this discussion, and it's great. I think we uncovered a lot of things from both of our viewpoints that make total sense. And I just want to thank you again, Paul, for coming back on the show here. Again, this is a really, really good informational piece for a lot of people right now. I think we're going to reach a lot of dentists, make a big impact, and address a lot of the considerations that they're going through right now at their office. So where is a place that if someone is interested in some advice, wants to get with you, see what your services are for CEDR, you guys have done an outstanding job at my office. I commend you fully for everything you've done. It's been probably the best money we've spent monthly out of anything, and we've avoided so many headaches because you guys have almost seen it all. I know we say in pediatric dentistry, we haven't seen all. You probably haven't, but it's really along those lines that you guys are excellent at what you do and get the right answers and right advice to your clients.
Look, there's two ways. You go to our website at CEDR, CEDR Solutions. It's, an acronym, CEDRsolutions.com. You can go there. You're going to be encouraged to sort of join in to a community. That community is called HR Basecamp, and it is on Facebook. And I highly recommend that you guys jump in, join HR Basecamp on Facebook. You can ask questions in there. There's more than 10,000 dental and medical professionals in the group. We have people in there answering questions. But ultimately, if you really need close-in support or you want an HR company, we're very affordable. We're designed for small practices. Go to the website and just learn a little bit more about us and see if we're the right fit for you.
Thank you for listening to the Sprig podcast. If you enjoyed the show, be sure to subscribe, leave a review, and share on social media. If you have any questions or if you have a topic you would like to hear covered in a future episode, please email podcast@sprigusa.com.